Hello everyone, I'm Hartford Healthcare's Tina Verona. We thank you so much for joining us for this special Facebook Live edition where we have assembled a panel of experts to answer all of your questions. No doubt, these are very challenging times and we want you to know that we're here for you. We encourage you to ask our panel of experts what's on your mind. There is also, if you notice, a bit of distance between us. We are safely exercising social distancing. I want to introduce my panel of guests. Joining me is Dr. Laura Saunders. To my left, she's a child psychologist at the Institute of Living to talk about the anxiety and stress people are facing and what you can do to cope. Keith Grant is our System Director of Infectious Disease for Hartford Healthcare. And on the end is Dr. Faika Chima. She's an infectious disease specialist right here at Hartford Hospital. First of all, thank you all for being here today. This is such an important message, and we have many topics, and we want your expertise to help the folks out there. Keith, I want to start with you in terms of Hartford Healthcare's response to COVID-19, to the outbreak. Every day, information is changing. Drive-through testing is being implemented. Talk about Hartford Healthcare's efforts so far to combat COVID-19.
Yeah, absolutely. So I think if there's ever such a thing to say, the good thing about this whole process is we've had some time. In that we've been preparing since this incident occurred in Asia. And we've only ramped up our preparation over the last few weeks. We've gone from a process of preparation to now mitigation, in that we're now seeing cases not thousands of miles away, but cases on next door, basically, right? In fact, we had our first case less than a week ago. So in regards to our preparation strategies, we've implemented visitor screening process. We've actually implemented a limited visitor restriction process. What people should expect when coming to Hartford Healthcare now is a screening process that they will go through that will examine symptomology, will examine travel, and any exposure to anyone that's been confirmed positive or being ruled out for COVID-19, or anyone that has flu-like symptoms, to include fever, cough, shortness of breath, and myalgia. I think from a system perspective, one of the things that we're also focusing on is the fact that there's obviously limited resource. Limited resource in not just to Hartford Healthcare, but to the general healthcare population. And I think for the first time we could say what impacts us at Hartford definitely is now impacting the entire healthcare population globally. There's a increase in demand. There's a decrease in supply because a lot of the PPEs are being produced in China. So we have a decrease in supply and increase in demand, and economics said that's a problem. So that's one of we've put into place mitigation strategies to try to address that. The other piece of it is we've recognized really soon that misinformation to the public was a significant limitation and a significant hindrance. And we established a call center, and through the call center we're now vetting over 1,000 calls per day across the nation, basically. So that's been helping getting the right information out to the public. Recently we've set up our testing center, and the testing center again is a community-based process, and it's set up primarily to facilitate the testing that needs to be done as soon as possible in order for us to mitigate and help people to get isolated as soon as possible.
Right.
And there's many more. There's a significant amount of planning that's going on behind the scenes in order to keep. But our primary focus is the appropriate information, the right clinical addressing this incident clinically appropriately, and definitely safety for our staff, our colleagues, definitely safety for our community and safety for our patients.
With regard to the drive-up testing, Mid-State Medical Center is launching their drive-through testing today. Hartford has been the last 2 days. Lots of people coming in for that, registering for that. I want to talk about what they need to know before they simply just drive up, because you can't do that. So I want to make sure that we disseminate that information.
Definitely. So as it stands right now, PCPs are allowed to order. There's the requirements for getting tested, and this is via the CDC, and there's significant data, and Dr. Chima will talk about that, but there's significant data guiding who to get tested, right? And what we want to focus on are the people who are with comorbidities, people who are elderly, people who have, again, the symptoms that I described before, so fever, new shortness of breath, difficulty breathing, and myalgia, so to speak. And an order is placed by your primary care. It's located 560 Hudson Street, and you get in queue and come on in. They'll do a swab process. There's some instructions that you will get when you drive up. It's very important to follow the instruction. This is a new process, so safety is absolute, so definitely focus on that. And we'll get you swabbed, get you tested, and you should have your results within days.
Dr. Chima, let's talk about social distancing. We've been hearing a lot about this the past week or so, even longer. Explain social distancing. What exactly does that mean?
I know we've heard a lot about social distancing, and we see what we're seeing is that when you go about your daily life, you drive out, if you are driving out, and you know people around you, and you see that everybody's doing fine. So that kind of seems like a hard information or a fact to grasp, that you're being asked to stay home when everybody around you looks well and feels well. So I want to stress to you that the social distancing that we're recommending is important for people who are elderly, who are above the age of 65, and who have underlying medical conditions such as heart disease, lung disease, high blood pressure, and diabetes. Why is it important for them? It's important because we know from all the data that is coming out from China that these are the population that will get complications from the SARS-CoV-2 infection. These are the patients that we need to be worried about. These people will end up with most likely severe cases of the infection, will get a severe case of the pneumonia, and will most likely need to come to the hospital and need medical attention. So even though you feel fine and you're younger than 65, your ability to stay in the house will have a huge impact on everybody else around you. You may not meet this person, but you will definitely play a very important and key role in saving their life.
And Dr. Saunders, we hear, I mean, you pick up the newspaper, you turn the television on, and this is all that you're hearing about. And it's social distancing, it's staying indoors, it's restaurants are closing. I mean, these are unprecedented times, no doubt. The level of anxiety among people, families, how do you redirect that anxiety? How do you cope with something like this?
So Tina, these are uncharted territory, and for the most part, I think there is a very high level of anxiety. I'm particularly concerned about parents whose kids are typically in school at this time, and now the kids are not in school. A lot of the public schools do not have any online platforms yet for educating kids. So as much as you can to provide some structure. It doesn't have to be the same as a school day, but provide some sort of schedule or routine. We as human beings thrive on schedule and routine. Some parents are able to work from home, but some parents, in fact, actually have to go to work. So we still need some child care centers to be open. You know, there are lots of people offering to do babysitting and other things. While we need to do social distancing, we have to really provide guidelines for how we can function as families whenever possible, to stay home, to be together. But when you have to be out or when you have to do things, to really follow the guidelines. I would say there's a lot of parents that are very, very worried at this time.
Absolutely, and rightfully so. We do have our first question from Matt. He asks, there is a lot of information on symptoms in adults. I have 2 toddlers. Is there any information about how symptoms present in children? So Keith or Dr. Chima?
Can I grab that? You want me to grab it?
I'll grab it.
Okay.
All right, so what we do know is, from the largest surveillance information that has come out of China, that the children do get this infection, but they have mild symptoms, and they can present, these mild symptoms can just be mild flu-like symptoms, just like you would if you were to get the flu. You could have a low-grade fever or a high fever. You could have a cough. You could have a runny nose and sore throat, but we're seeing less of that. But children can present in any way. So far, what we do know is that the children are having mild symptoms, they do recover quickly, and they do fine. So our recommendations are, if you do have children at home who are exhibiting these symptoms, just not to worry or panic, just watch them closely, keep a close eye on things, and if things were to progress, then you would need to get medical attention with their pediatrician.
And it's interesting in children because their immune systems are still developing. Can you explain that, why the symptoms can be not as bad as maybe for somebody who's elderly, where their immune systems are compromised as well?
So we're not 100% sure about that. We're based on the data, as Dr. Shima spoke about, we're seeing very mild symptoms in children. Yeah. What we do know is that the coronavirus and different versions of the coronavirus are present in about 40% of upper respiratory infection in kids annually, so on a normal basis. Most of these are very mild, so very mild symptoms. In regards to the body's response to the disease process, what's contributed significantly to the mortality is ARDS, acute respiratory distress syndrome. It's an immune response, and it's hard to say what this could be as a result of, but the fact that, as you said, there's a developing immune system probably doesn't have the capability yet to have launched this aggressive response, and in that is unable. ARDS doesn't actually happen in kids, but again, this is just supposition based on data that's been out.
What about any correlation between children and the vaccines that they get? Could that make them more immune to something like this?
Not specifically to this, but it allows, because remember, one of the comorbid conditions, a healthier body has a better capability of dealing with this process.
Right.
So vaccinated kid who has less probability or susceptibility to other disease processes will be better prepared to deal with this. So not specifically to the coronavirus, but to protect them from other infectious diseases, and hence get them more capability of dealing with the coronavirus if they do get it. So
we do recommend that, it is a good idea that if you do qualify for the pneumonia vaccine, this would be the right time to get it, because with the SARS-CoV infection, you can develop a severe pneumonia, and if you are already protected from other strains of the pneumonia infection, it would be less, it would offer some level or degree of protection.
Yep. Okay, so thank you for that. And Matt, thank you for the question. We have another question from Harriet. She asks, my mom is in a healthcare facility. I was not allowed in, but I see the staff inside are not wearing protection. How come? Thanks for the question, Harriet.
So personal protective equipment it's exceptionally important in dealing with this disease process for a number of reasons. One of the primary things that we advise is source control. So if a patient comes in and we realize this patient has symptomology, the patient would get a mask, and that would relieve significantly the burden of that disease actually spreading. The other piece of it is direct care providers, anyone within 6 feet of this patient, will don the appropriate PPE. The PPE structure increased significantly with how significant of an aerosolized potential there is with the process that's being done. So intubations, for example, the requirement is significant higher level of PPE than anyone else.
Yeah, and just explain it. So when we saw Ebola a few years back, that was completely different than the PPE
absolutely.
That is required for right now. Just explain for the viewers what the personal protection equipment is required for staff dealing with patients with COVID-19. What does that consist of?
So glove, gown, mask, face shield, basically. And obviously there's a process where the particles we've seen are heavy enough to fall once it leaves the respiratory system, but you have the capability for contracting it by touching your face,
right.
Hence the face shield and the mask itself. It's not, questions I've gotten is if I touch this without any contact with any orifices of my body, which mouth, nose, throat, would I be getting this disease? The research is saying absolutely not. So it
right.
needs to be some interaction with those pieces of your body. Hence, the glove, proper hand sanitization. And I can't stress that enough. So if you touch something, if I touch this surface and it's on my hand, at this point in time, it means nothing to me. What it does mean, though, if I do hand sanitizing, I completely kill that chain. However, I now have the capability to pass it on to my grandparents and other people that are more susceptible.
Or if you're touching your face.
Absolutely.
And so how long do these spores, from the time these droplets are there, how long do they last?
It depends on the kind of surface. Data is saying between six hours to, in some cases, about 2 days on surface, not in ear. And that's why it's very important to clean surface and wash your hands when you touch anything. So
I'm going to take a minute to just explain to the audience why hand washing and hand sanitizing is important. So it just requires me to just kind of go into a little bit of detail that the coronavirus infection is like a self-assembled nanoparticle. If you've seen pictures, it's like a rounded circle. It has these crowns coming out of it. And in the center is it has the weakest link, which is the outer lipid or the fatty layer. And when you use soap or hand sanitizer, it just causes that fatty outer layer to dissolve. And that's the weakest link in the virus. And when that layer dissolves, the rest of the virus just falls apart like a house of cards. So that's really why, it's important for the audience to understand that hand washing and hand sanitizer just gets rid of that weak link in the virus. And when that link kind of is dissolved, the rest of the virus just kind of disseminates, disrupts, and falls apart and is no longer contagious. And that's why we also recommend that we should be wiping down all surfaces with Clorox wipe, or with water, with a little bit of bleach. And those are basically those recommendations where they come from.
Yep.
Good point. Dr. Saunders, I want to come back to you a little bit in terms of how anxious people are and the state of mind. And what are some of your recommendations that family can do, now that the kids are home? I mean, this can be a time of family bonding, I guess, if you will, right?
It's important to turn these times into opportunities, right? Thankfully, the weather's nice outside. So to go out for a walk as a family, to go for a hike in the woods, to do things that are outside, that get you some fresh air, that get you access to sunlight, little vitamin D, doing things that feel like you're connecting with the people around you. I mean, I work with a lot of very vulnerable people where social isolation is very, very dangerous for them. So reaching out, even via FaceTime or phone calls to people that have some risk, maybe it's the elderly, maybe it's people that that struggle with mental illness. So using these opportunities to connect with your family. It's also okay to have what I call downtime, right? Where child A is in one part of the house, child B is in another part of the house, parent is in another part of the house, to actually have some separate time. We need to learn self-soothing skills. What do we do when we have downtime to soothe ourselves and help ourselves feel better? It might be reading, it might be taking a nap, it might be watching a show. I'm generally not a proponent of electronics and screen time for kids, but this is a time when you can relax a little bit about the screen time. Kids need that separate time to self-soothe.
Well, we've all been thrown off of our daily routines, our schedules. Nothing is sort of quote unquote normal anymore. So is it almost like you have to sort of reinvent yourself in your daily routine and come up with a new routine, at least for this time being? Would you recommend that?
I would recommend that. I think what's going to happen is as this phenomenon goes on, right? So we all know what a spring break is, whether it's in March or April. We can manage a week. The concern will be is if this turns into 1, 2, 3, 4, 5 weeks. There's some talk about schools not even going back in session. That's creating a high degree of panic for a lot of parents about how they will manage this time, especially parents that need to go back to work. How will they structure their kids' time for such an extended period of time? It is generally better to look at this in small chunks of time. So, because that's easier to manage.
Right.
I don't know how things are going to be in May, so let's focus on what we're doing on Wednesday and how we're going to structure time on Wednesday, maybe looking into Thursday, but to break things down into small, manageable periods of time, because that feels a little bit more in your control.
Yeah, definitely good advice, because it definitely can be overwhelming. We have a question. Marissa Wright asks, how concerned should I be if immediate family works in the Danbury Fire Department? Marissa, thanks for watching and thanks for asking the question. Who would like to take that?
I think, should you be concerned? Yeah, I would be, definitely. But there's so much you could do to mitigate and relieve that concern. And this goes out to anyone that works in healthcare, and this shouldn't stop just with coronavirus or with COVID-19 disease process. I think if you're exposed or think you've been exposed, the appropriate PPE, so I encourage your loved ones to use the appropriate PPE wherever you work in healthcare. Absolutely err on the side of caution. If you suspect that this person could have something, definitely get a mask when possible to the patient. If you think the minute you get home, I could say with my practice, the minute I get home, I have zero contact with loved ones. I go directly to a shower and everything that I'm wearing going to get into the laundry getting washed. And I think that's a practice on wash on hot.
Yeah.
And definitely a practice that we should be using, not just with the coronavirus. I mean, healthcare it's not a clean place. Like we have the potential to bring stuff to our family. So you should be concerned, but if your loved one is practicing the appropriate, is putting in appropriate practices, they should be fine. We're at risk. We talk to our families as much, and it's the same. I'll tell you, it's the same thing that I will tell you to do. It's the same thing that we're doing.
Right. All right, thanks, Keith, for answering that question. We have a question from Ash. Laura, I think this is for you. My son has asthma. He is 3, and I am very scared for him. Please help me with my anxiety. So again, a lot of anxious parents out there. What would you tell Ash?
All right, Ash, thank you for asking that question, because I think there's some validity to your anxiety. We know that these are really difficult, anxious times. New information's coming out all the time. What I'd like to recommend is that you find other adults to share this with, that you really do your best not to let your children overhear your level of anxiety, your spouse, your friend, whether it's reaching out through social media or phone calls or in other ways, finding a way to release it. I've actually recommended to several people that they keep a diary. Write down some of your thoughts and feelings, because we may be able to revisit this at a later point and see, wow, times are so much better now. Remember how anxious I was. So find really appropriate ways to release that anxiety and try to really keep a shield between you and your children.
Thanks, Laura, for the response. And I think that's a two-part question that Ash was asking, because she's talking about a child with asthma. Yeah. So I'll pose that to you, Keith, or Dr. Chima, in terms of children with asthma and the COVID-19 virus.
So I think the best thing to do in this situation is to make sure you have enough of their medication for treatment of asthma. If they have an acute exacerbation, make sure you have at least a 30-day supply of the inhaler and all the other medication that they need to get through that. If they are having an exacerbation, try the measures that you do typically for any kind of situation related to their exacerbation. And then if they're not helping, then you need to call your doctor or your pediatrician about it. Just to reassure parents, we do know that the children do fine. We need to feel reassured that in this virus, the children have mild symptoms and majority of them will do fine and will do okay. We just want to make sure that while your children are at home, that this is not an opportunity to start play dates, this is not a snow day, this is not early spring break. This is time for us to be more aware of what's happening around us in the United States and around the community, and every child, every adult under the age of 65 is doing their part to make sure that we're keeping the vulnerable population safe.
Thank you. We are getting a lot of questions. We do have a wonderful panel of experts here. Dr. Laura Saunders, child psychologist, Keith Grant, and Director of Infection Prevention here at Hartford Healthcare, and infectious disease specialist, Dr. Vika Chima. Please continue to ask your questions. We will get you the answers with our panel of experts. We have a question from Austin, asks, do we know if animals can spread the virus? We keep hearing about this. Thanks, Austin, for the question. Anybody want to take that one?
I'll take that one. Thanks, Austin. Great question. A lot of us here in the United States have pets. We don't really know the clear-cut answers to that, but if you were to look up CDC, there is some recommendations, and they do report that there is transmission of the virus to your pets, and that's basically all we know, even as healthcare professionals and experts, that there is reports that they could, but we don't know 100%. There is no evidence or scientific data explaining it. But to answer your question simply, that they could be possible transmission to your pets of this virus.
And we haven't heard of any pets with COVID-19. Have we?
Not in the U.S.
Anything?
We haven't heard anything.
Yeah.
I mean, not in the U.S.
All right. Brian asks, what are the symptoms for young children under 6 years old? Thank you, Brian, for the question.
Thanks, Brian. Good question. I mean, as we discussed before, children's symptoms are very mild flu-like symptoms. As Dr. Chima said a few times before, children generally recover very well with this disease process. So very mild flu-like symptoms, some malaise, but you will probably you will have kids that have this disease process that will have a stuffy nose, and that's it, basically. And this is what good data is showing us. So.
All right. Alex asks, who posted the possibility that ibuprofen can make it worse? Do you think we should avoid taking anti-inflammatories like ibuprofen and during times like this? Thanks, Brian, for the question.
Thank you, Brian, for that question. I did come across that information. I did read up on it. We're just not really certain at this point what role the ibuprofen or anti-inflammatory medications are playing. For now, we just exercise caution as we learn more about situations that are continuously evolving on a day-to-day basis. Thank you.
All right, Rebecca asks, for individuals with asthma, traditional and cough variant, and you take a daily control inhaler like Singulair, does this place you at an increased risk for contracting COVID-19? Thanks, Rebecca.
I will take a shot at this. I think you're asking, does the Singulair itself increase the risk based on what the Singulair does? Not enough data. The next question would be, does the asthma within itself put you at an increased risk? So asthma is a chronic lung disease. I would say, based on the data that we're seeing, there is some increased risk, but very, very mild asthma within itself, especially within a younger population.
All right, another question from Alex asks, if we are self-isolating but need to go to the grocery store, what steps should we take from leaving our home to the store and back home again to keep our families and ourselves safe? Thank you.
So if you're self-isolating because you have symptoms, you should not be stepping outside of the house. This is where, having a good network of people and family members around you comes in. Make sure that you are staying in touch with a family member who doesn't have any symptoms of COVID-19. You can text them to help you with your groceries. You can have them drop them off at the front door, and they can help you with any supplies related to groceries or medications that you may need. And we're kind of setting up those recommendations for even the elderly population. This would be a good time to see, if you have any family members above the age of 65 or have underlying conditions. The recommendations are for those people to stay at home as much as possible. Text them, check how they're doing, see if they need anything. Don't come to their house unannounced. That would not be the recommendation. But stay in communication with them. These are times where we get to connect with each other. Instead of being anxious and worried, we should reach out to family members who we haven't spoken to for a while, see how they're doing, and see if they need anything from us, even if it's just a listening ear.
Good advice there. I've seen personally people outside with masks and with even gloves on. Do you recommend that? Is that safe protection against contracting this virus?
So for many reasons, if you have symptoms, stay home. If you have symptoms and you have a job that requires you to be outside for some reason, you should still not be doing any of that. You should still be staying home. Masks should be worn by people who immune compromised and have symptoms, but they do need to still see somebody like in healthcare, like transplant patients, cancer patients, because chemotherapy doesn't stop in the middle of a pandemic. Those patients still need to come to the hospitals. They still need to get their chemotherapy. Transplant patients still need to see their providers. If you have symptoms, those patients should be wearing a mask and should be coming in to see the providers at that time. If you don't have symptoms, the mask just makes you feel better and gives a false sense of security, but it's really not doing a whole lot. And we're running short of masks, and we're saying that we need to keep that supply for our healthcare workers who may need them more urgently. So wearing a mask and wearing gloves in a situation when you're not sick, you should not be doing that. Hand hygiene, hand sanitizer is the best approach in this situation.
All right. Susan asks, is this airborne?
Susan, good question. So Susan and Pamela is the next question. I'll answer both at the same time. So Pamela's question was, how does the virus spread? Is it ear, physical, or touch? Two-part answer. As it stands right now, based on what we've seen, the particles are too large to stay within the air for an extended period of time, which would define airborne transmission. However, for high-risk procedures, such as intubation, we're considering that needing to have airborne precaution. For otherwise, we're using a contact droplet precaution process, such as like with the influenza virus. So.
All right, we have a question from Samantha. She says, I read somewhere that this virus can live on surfaces such as cardboard, plastic, and stainless steel. My fiance works for FedEx, and I'm curious if his exposure to packages could increase the risk of getting this virus. Thanks, Samantha, for the question.
Go ahead.
So I think the biggest risk your husband have is the fact that he's probably with his job or his role, he's probably in more contact with more people than the average person. I think that's his biggest risk. With the packaging, I've gotten questions is if we had a lot of packages being shipped from China, with the process and time frame that shipment packages go through right now, there's a higher probability that the virus will not stay on the packages by the time you get to handle the packages. With that being said, I personally would use every precaution when I open a package, not just for the coronavirus, as in proper hand hygiene once you're done opening your box. Listen, these boxes have been through multiple warehouses on multiple continents sometimes, and we should be practicing as such. I think the good thing with all of this, when this is all said and done, a lot of people are going to be slightly more aware about infection prevention practices. These are practices we should be doing regardless of coronavirus.
Every day.
Absolutely.
Yeah, absolutely. I think you'll find that when all is said and done, I think people's habits will be changing for the better.
Yep.
Jennifer asks, should we be spraying our mail and deliveries with disinfectants? How do we wash our produce to make it clean and safe?
So even before this pandemic, my recommendations to everybody is that produce, when you bring them home, should be washed with, just water. Just run through water, make sure you're washing it, and then also when you're done washing it, make sure you wash your hands as well after that. The first half of the question is about the mail. It's hard to, these are things that will cause anxiety. We are staying to be anxious, but not create more work for yourself where you're causing more anxiety for yourself and other family members, that things seem to just fall apart. We're saying just also use common sense. Going back to that, use common sense, practice precautions, but if you're bringing in mail, put the mail down. You can wipe up the surfaces if you want to be extra careful, but then wash your hands, and while you're putting the mail down, make sure that you're aware that you're not touching your nose, mouth, and eyes.
Yeah, and Dr. Saunders, I want to bring you in on this because just based on the questions that we are getting, how do I wash the fruit and the mail? You can see that there's the level of anxiety there. What do I do? And this really is, as you mentioned in the beginning, these are uncharted waters. This is new territory for us. It really is the fear of the unknown for a lot of folks out there. So can you just talk a little bit about that and how to navigate through that?
So Tina, we are thinking about things that we never thought about before. I don't think anyone ever thought when they had a package delivered, oh my goodness, there might be germs on this package,
Absolutely.
right? I think people were just excited they had a package and they opened it and then they used whatever was in it. So this is making us think about things in ways that we never ever thought about them before. If you're standing next to someone who has a cough, perhaps because of an allergy, perhaps because of the dryness of the air, everyone sort of steps away from that person. So my worry a little bit is that we're going to create a level of paranoia that everyone, that there's germs and infections everywhere. That's actually true, but our bodies have immune systems for a reason. So to really stick to the facts. I mean, I'm so happy people are asking questions and that you have this kind of forum. Harvard Healthcare has a great website with information. The CDC has a website with information. So to really stick to the facts and not let hearsay and hysteria take over, because it would be easy for that to happen. I mean, there's a underlying level of paranoia that other people around us could always infect us. While that might be true, that's a really hard way to live life, and it's going to be hard to get out of bed in the morning if you're just anticipating that something bad's going to happen each day.
Well, and true too is that we're so thrown off of our routines that we're at home and we're just thinking about this. So it's on our minds. It's when you turn the television on, when you read the paper, it's everywhere. So you really can't escape it.
It's every conversation.
Right.
Every conversation. If you anywhere you are, any conversation, this is what's being talked about. It is on. It's on everyone's mind. So, and I think for right now, there's nothing we can do to change that. Right. We are looking for information. We're looking to get have someone to talk to. The hope is that as we continue to practice safe guidelines and social distancing, that we can start to go back to some of our other routines. Remember things that used to bring us joy. It is harder now when we don't even have restaurants to go to or do other things. Socializing with friends is always a good thing. We can't really do those things now. So, but to look at it as a short period of time, we need to do this right now to prevent the spread of this virus, and then with the hope that we have better times ahead of us.
Absolutely. We have a question, speaking of social distancing. Brooke asks, should you social distance from parents actively working with the public? Thanks, Brooke, for the question.
So I think if let's use healthcare for example. Am I socially distancing myself when I get home from my family? As we spoke on before, if you put the proper precautions in place, there's really no need for that. I think the minute I walk in the door, there's a thing. Generally, my daughter knows when she comes up to me. There's no touching, and I will when I go through my whole process of taking my clothes off, my clothes put in the wash, go get a shower and come downstairs. It's daddy-daughter time kind of thing, right? I think if we practice those, we're perfectly fine. Again, keep in mind, breaking the chain of infection is kind of what we're saying. So what I could probably bring home, you're right, for someone that's working in the public, it's significantly more for someone that's not working in the public. What I'm bringing home, what Dr. Chima is bringing home, probably significantly more than the average person is bringing home. But it's for us to put those initiatives in place to break that chain of infection. So.
The only thing I would add at this time is that if you have grandparents in your circle of family, then those are people they would not be allowed to come visit you during this time, that they would be staying at home, and you would not have elderly parents coming out of state. We get that question a lot, can they come visit us? This is not the time for elderly parents to be visiting you. Everybody needs to stay in their house, especially above that age, that number 65 and above. They need to stay in their own homes. They need to get help from other people around them. But visiting if you do work in a public area where you are in contact with a lot of people, would not be ideal in this situation.
Yeah.
Donna asks, how are former preemies impacted? Are 7-year-olds that were born at 26 weeks gestation more prone to complications if they were infected? Thank you for the question.
Thank you for that question. We don't really have an answer for that, but I think it would just fall into the same category, that if they're healthy now, they're up to date on all their vaccines, they would, even if they do acquire this illness, they would just have a mild form of the disease. Yeah. So they would be safe.
And Dr. Saunders, we talked a little bit about this, but while this is the new normal, it is a temporary normal. Would you say that?
I think that's what we're hoping for. I think the anxiety comes up when you start to go too far into the future, right? Like, what am I going to do in the summer? How am I going to manage this in the summer? Let's focus on this week, and then maybe start with today, maybe by the end of the week, and that if we break things down into small chunks of time, it helps us feel a little bit more control and a little bit less anxiety. I think anxiety by definition, right, is when you become more irrational in your thinking. So to come back to more rational thought, let's focus on what we do have control over. We have control over the things that we do for ourselves today. I don't have any control over what's going to happen next week. So keep things in small chunks of time.
What about folks who are just anxious anyway? Like, forget COVID-19 aside, who are just anxious people anyway, and then you add this to it and it just exacerbates it. What do you say to those people?
So, those individuals that are more vulnerable, those that are already prone to anxiety, those that are already prone to depression or other kinds of mental illness, honestly, those are the ones I'm certainly most worried about. We do need to look at this as a very different time. Even over at the Institute of Living, we're looking at telehealth. We're looking at ways to minimize, at contact. But what we know is that, and I say this all the time, right, social isolation is gasoline on the fire of depression. So we need to be aware of the risk factors and those that are most vulnerable. And we know there's an aunt or an uncle or a cousin who is already prone to anxiety and depression. Let's take this time to just reach out and say, send a text. I actually myself have gotten a lot of texts from people just saying, thinking about you. So the more that we can do that to make that sense of connection, that social connection, even via text or FaceTime or in other ways, helps reduce that isolation. Right now we have to have some amount of isolation and social distancing, but to acknowledge those that are most vulnerable and what can we do to connect with them.
Well said. In case you're just joining us, we are talking live with a panel of experts here across the Hartford healthcare system. To my left is Dr. Laura Saunders. She's a child psychologist at the Institute of Living. To her left is Keith Grant. I called you Doctor. Keith Grant, Director of Infection Prevention here at Hartford Healthcare. And to the left of Keith is Dr. Fika Chima, an infectious disease specialist here at Hartford Hospital. We're getting some great questions, and we're trying to get to all of them. We do have another question here from Christine. She asks, why are the judicial courts in Hartford still open? Social distancing. Well, again, here's that social distancing question where a lot of people, I think, are perhaps maybe confused as to what social distancing is. What does that actually mean? I know you went over it in the beginning. Let's go over it again in terms of what exactly does that mean? How far apart do we need to be?
So the reason why the social distance concept came up by what we've seen where the distance that this disease can spread, right? Where the particles can travel. And what the data is showing is about between 4 and 6 feet. So because of that, they've said that you should stay at least 6 feet apart when you're communicating with someone, and maintain that as much as possible. Right? To answer that question, I don't know.
Well, yeah, we can't speak upon behalf of the courts, but just really explaining the social distancing and the maintaining the level of safeness in terms of how far apart we need to be.
That's, I think we can't stress that enough. And again, that's breaking that chain of infection.
Right.
So if I'm infectious now within that, what it's saying is 6 feet circumference around me is where my ability to spread that disease would be.
Yep.
So, and that's very, very important. So that's why maintaining that social distance is significantly important.
All right, thanks, Keith, for that. Karen asked, what is the viability of the virus on different surfaces? I think we touched upon this a little bit with the packages, but what about other surfaces that can really contain this virus? And I'll add a question in there. Can it adhere to some surfaces longer than others?
You want to get that?
Yeah, absolutely. Yes, so it can stay on some surface significantly longer than other surfaces, but the processes to break the chain of infection is absolutely the same. So it doesn't really make much of a difference. I mean, you should be considering every surface as a medium to which this disease can be spread, right? So this bottle within itself, if I take up this bottle, I should be doing I should sanitize my hand when I'm done with this process. So the surface itself shouldn't be what we're focusing on. It should be the fact that any contact, any foreign contact, we should use hand sanitizer afterwards, or some form of hand washing.
And we're seeing high touch surfaces, so we don't want to we're not saying go home and go, at home go crazy and just wipe everything. Just high touch surfaces. What does that mean? It means like doorknobs, kitchen countertops. Other areas that where the family kind of gathers around would be the room that you kind of would wipe down carefully, but not every surface in the house. It would not be physically and mentally possible to cope with that.
Yeah, so when you say high touch areas like maybe the refrigerator, door
Handles,
handle, things that you would touch frequently.
Yes.
Yeah. Okay, so Casey asks, how long could you have the virus without showing any symptoms? I've read anywhere between 3 to 7 days. Thanks, Casey.
Thanks, Casey. So that is correct. The incubation period is about 4 to 6 days. In some reports, the maximum duration can be up to about 14 days, but we're kind of taking the median duration, which is about 3 to 7 days. We say that The infectious period is usually 12 hours before the symptoms start, and most infectious period is about the time the symptoms, for 12 hours before the symptoms start, and about peaks at about 2 days, and then 4 days to 7 days. So that's why we're saying that at 7 days, if your symptoms have resolved from the start of your symptoms, you could potentially come back to work.
And if you're asymptomatic, you can still spread the virus. Is that correct?
So that's a great question, Tina, and a lot of scientists and a lot of health experts are kind of looking into that a little bit more deeply. We do know that there is transmission of this virus from people who have no symptoms, called asymptomatic carriers, or pre-symptomatic carriers, that they have no symptoms, but they could spread the virus before their symptoms start. We do know that this is possible, but we also have some information that right now the percentage of these people contributing to the overall new cases is expected to be low. And this may change, things are changing,
Right.
but this may be true today, but may not be true tomorrow.
I want to ask about vaccinations in terms of the flu. Obviously, there's a flu vaccine, and I know things are rapidly changing, but in your opinion, or what you've seen so far, or what we know so far, is this something that the vaccine, once it is developed, would be a part of the influenza vaccine, or is this a separate vaccine that we would have to get? What do we know at this point about that?
So it's still too early to know what kind of vaccine we're going to have. We do know, and that's really promising, is that in Seattle they are testing some subjects for the vaccine. It's hard to know that this will be grouped together with the flu vaccine. We do know that this is not part of the influenza virus. So influenza is a virus, it's a separate virus. This is part of the coronavirus family, which is a separate virus family entirely. And the coronavirus family has a lot of viruses that live within that family, of which the ones that can cause severe infections is what we know is the SARS coronavirus family, then we have the Middle Eastern respiratory coronavirus family, and now we have the new SARS-CoV infection, which is the new family member to this big group. So we don't know eventually if the vaccine that is being developed, it seems low likelihood to be part of the flu vaccine. We just don't have answers to those questions if the vaccine will be something that we'll need to get routinely. We still have to get that information and determine that. So it's still too early to have answers to all those questions.
All right, well said. Olivia asks, how long can we expect this to go on for? I think that's the $1 million question right there, right? Right, panel?
Yeah, absolutely.
Thanks, Olivia, for the question.
Definitely. Very difficult to answer. I think if you look at models in, I think China yesterday reported 13 cases. It's been their lowest case, so that's really good. And I think they started in December 6th, start having cases. So if we look at that model, we can say within the US, we have probably 2 to 3 months to go. If we look at that model, I could look at their healthcare system and their healthcare response, and we could probably reduce some time on that. I think our response is slightly different. To be fair, we had more time than they had. We also, we've learned a lot from what they've done or didn't do. So it's hard to guess, but if you just look at an epi model, I'd say at least 2 to 3 more months from a pure epi model.
And I mean, with the response from local, state, federal government to practice this social distancing and self-quarantining, I mean, that will obviously help curb this or contain it quickly than if we didn't implement those right from the get-go, would you say?
So just to be clear, the social distancing is not going to stop the virus. The virus is here. We can find ways. The virus is here. We can't stop the virus in its track, but we can find ways to slow it down. So what the social distancing is doing is what people may have heard on television, flattening the curve, slowing the spread of transmission from the virus, so that not everybody who will have severe illness or severe pneumonia will come all at once to the healthcare facilities, and then just the healthcare system will be overwhelmed because we only have a few or X number of ventilators. We have only a few numbers of healthcare workers, so we don't want to overwhelm the system by a lot of people having severe complications with this infection coming all at once to the hospital facilities. So it will not stop the spread. It will not stop the spread of the virus, but it will definitely slow it down, stretch it out, and spread it out over a period of weeks to months that we may be able to cope with it. We will still continue to see infections. We have to kind of expect it at this time as we switch to broader based testing and more tests are becoming available. So we should expect the numbers to go up. We're just, we're advocating for social distancing because we want to be able to keep you safe, and we want to be able to keep other healthcare providers safe at the same time.
And I think the response to close restaurants and to keep people at home obviously is going to be a big factor in terms of flattening that curve eventually and slowing that spread down when you keep people home and out of public places. Rebecca has a comment and a question. Thank you for sharing this important information. A few people I have spoken with have mild symptoms, tight chest, slight fever, but not much more. Is that someone who should be quarantined, or could it be any virus? Thanks for the question, Rebecca.
So yes, those are people that should be quarantined, long and short. Could that be any virus? Absolutely. It could be much more than so on our list of differential, or list of viruses we'll choose, COVID-19 is definitely going to be on that list, right? And because of that, without testing, we have to assume at this point in time that it's a possibility that this is the case, and they should be quarantined.
They should be self-quarantined.
Yeah, people like anyone that has any of those symptoms within our healthcare facility, we're going to ask to go home, basically, and be self-quarantined. Yeah.
All right, Emily Rozago says, "Hi, Keith."
Hi, Emily.
And Lori asks, if you take an ACE inhibitor or ARB for high blood pressure, are you more susceptible to a severe case of COVID-19? Thanks for that question.
So I've seen that data circulate. It's just a hypothesis. We don't really know. And just for other people who are listening in, we do know that the coronavirus, the SARS-2 virus, acts on a specific receptor, which is called the ACE receptor, which we see in the lungs. At this point, we don't really know if being on an ACE receptor blockade is protective or if it is harmful. So we're still learning about this. We're looking into it as scientists and healthcare specialists, and right now we don't really have a clear answer on that.
Another question from Mona. She asks, you may not have family members to depend on, then what do you do? I think that could be a two-part question for Dr. Chima and Keith, and as well as Dr. Saunders too.
I think we have to think of ourselves not as individuals, not as a family. We have to think of ourselves as a community. So even if we don't have family members, we have neighbors, they're part of our community, and we need to look out for each other. So, it'd be a good time to get their information, their phone numbers, their texts, and text them and check on them. And people need to step up and take care of each other. This is our finest hour. This is when we have to put our best self and best foot forward and take care of each other.
Wow, that was well said.
Yeah, that was great. Dr. Saunders?
Yeah, I mean, I think that there was a lot of worry in closing some of the inner city schools. What were kids going to do who need get their 2 meals a day at school. So there are more and more resources out there. Schools are sometimes still dispersing food to really look to your churches, your religious organizations. Even if you're not going to services, they still are networks to connect with. Again, reaching out to people that you haven't heard from that neighbor, you haven't seen them leave their house. Leave them a note with your phone number saying, if you need anything, please let me know. Those of us that are well, we need to look at these as opportunities to take a little extra time to think about other people that might be affected by this. But it does actually take a little bit of motivation to say, I think I need some help. I'm going to need to reach out to someone too. So it's going to be two parts to that.
Dr. Saunders, I also want to ask the question too, because again, we're in these evolving times, times of uncertainty, and for a lot of people who are maybe parents who are out of work, who may not be getting paid for this time that they're out of work, there's the financial burden and there's the financial stress factors that come into play. What do you say to parents out there, or to anybody out there, quite frankly, who are in that situation, or who might be faced with that situation?
So that's actually going to be an increasing burden as we move through these times. So I think it's going to be about asking, right? So if you are now not working, because maybe you work in a service industry, and you have trouble paying your mortgage, you're going to need to ask your bank for, you're going to need to ask and reach out. You're going to need to make direct statements about what you need to people, because otherwise we're not going to know. And if enough, people are out there saying to their mortgage lender, listen, I can't pay this month because now I will be out of work. More and more banks are going to come forward and say, listen, we're open to different options. So we have to, bring to light all the problems that are out there. People not working, childcare issues are a huge thing. People not having access to food. So there's more and more that we need to do.
Absolutely. We have a question from Darlene. She asks, what happens if you go to dialysis 3 times a week? If I have to, what do I do? Darlene, thanks for that question.
So, Darlene, good question. I think any essential services that you need to get from your healthcare provider, dialysis would fall into that category. You'd definitely want to go get dialysis. I'd reach out to my primary care, or whoever is managing that from a healthcare perspective for you. I'd let them know definitely that you have, not just if you're a confirmed case, but if you have certain symptoms. From a Hartford healthcare perspective, we have processes in place to address that, to allow you to still come in and get whatever needed services that you do need and be supported and protect the staff and also protect you. And I'm pretty sure or other healthcare systems across the state have that in place as well.
And as Dr. Chima mentioned before, that for patients, cancer patients who are undergoing chemotherapy, those services continue even during a pandemic. So thank you. Alex says, I don't have any symptoms, but I want to know how to safely go out when we need groceries and do not want to catch it. Again, more of the anxiety coming up. And again, I think this is where you see a lot of people wearing masks and even gloves, but what really should they do? It's that proper hand washing. I think we go back to that, right?
We're saying just to get groceries for about 2 weeks supply, get everything you need in bulk, so you're not, you're decreasing the number of times you have to expose yourself. And when you do have to go out, that you maintain good hand hygiene, you're aware of where your hands are, that when you're out, your hands are not touching your face, mouth, eyes, and nose, so that you come home, you wash your fruits and vegetables, but before you're doing that, you wash your hands, wipe down areas where you put down the bags, which would be included in the high-touch surfaces. So just common sense stuff and basic stuff that we've been really stressing upon.
Okay, we have a question from Milagros. In relation to pregnant women, I have heard in the news about a newborn with the coronavirus in Spain. Is this possible that there is some relation to the virus in the baby's fetal development? I'm in my 2nd trimester and getting worried about this whole situation. Thanks for that question. I think, again, that's 2 parts, I guess, for you guys clinically, and then for Dr. Saunders, again, on the anxiety part of it.
Yeah, definitely. I'm with you where you're concerned, and I appreciate your question. So I think as we pointed, 2-part question. So for one, most of the data that we're looking at, we've identified pregnancy as a risk factor. A pregnant person as being at high risk, primarily because there's some level of immunocompromisation or someone being immunocompromised during pregnancy. Risk to the mother. I know there is 1 or 2 papers or data points that come out and identify cases just as this, but there's not enough data that I've seen that I can say there's definitely incidents of fetal compromise. But again, there's so much limited studies. What I would say is, if you practice, you should practice as such. Practice as if at this point you're at high risk, and you're going to put the precautions in place just as we've been speaking about. So proper hand hygiene, clean your areas, definitely, social distancing, and be smart about it. But and keep informed. Definitely 100% keep informed. If you have specific questions, I would reach out to our hotline. I'm not sure the number, you probably know it.
We have the
so
number
definitely reach out to our hotline and we can help you with that piece of it. But definitely keep informed. I think the right information right now, Google is amazing, but it can be challenging.
Right.
Definitely can be challenging, but.
And Dr. Saunders, I want to talk to you about people Googling things.
Right.
You see a lot of things.
What I'm worried about is hearsay, right? So I heard about someone in Spain who, automatically when I hear something like that, I think, what's the source for that information? There was something going around on Facebook that gargling with salt water would, get rid of the COVID virus. So those are actually false pieces of information. So you need to really use reliable sources of information and not to let hearsay or conjecture or someone said be your source of information and allow that to fuel your anxiety. Please use verified resources of information.
Yeah, that's well said.
Tina, I wanted to add a reassuring message for the person who asked that question. The data that has come out of China and the WHO report from pregnant women was tested in patients, people who were pregnant in the last trimester. They tested the amniotic fluid, the cord blood, and the breast milk, and that all tested negative for the virus. So it is reassuring. They had mothers who gave birth to healthy newborns. Majority of them were fine. They did not have to quarantine the mother and separate the mother from the newborn. They were allowed to nurse successfully, and we didn't see any complications. There is that case of the newborn in Spain. That is just one case. That means that still would not change the way we practice. Like we've just mentioned, that we still have to consider pregnancy as one of the risk factors. Just like we would advise you in peak flu season and other respiratory viruses would put you at higher risk, this would be something that you just need to take extra precautions. That's it.
And the websites that you really should be, the credible websites obviously are the CDC, the World Health Organization. You can come to hartfordhealthcare.org/coronavirus, as well as our command center. Even long after our discussion is over and you still have questions, you can always call our hotline. It's 24/7 at 860-972-8100. We have another question panel from Karen. She asks, if you experience symptoms, fever, cough, how long are you contagious after the fever subsides? What is the average duration of the virus?
So the three symptoms of the COVID-19 is fever, cough. The main three symptoms of the COVID-19 are fever, cough, and shortness of breath. 50% of the people may not have fever at the time when they come and present with this infection. So half of the people when they come to the hospital may not really even have the fever. About 60 to 80% of the people who have this infection will have the cough, and about 15% of the people who have this virus will have vague symptoms like malaise, body aches, joint pains, and will have nausea and vomiting. In one case that was published in the WHO report, they had a case where a patient just had diarrhea symptoms as their primary symptoms before they developed fever, cough, and shortness of breath. So, we do hear fever, cough, and shortness of breath as the main symptoms, but it can present in many other ways that we do need to be aware of. The second part to that question is that
The average duration of the virus?
The average duration of the virus, if you have mild to moderate symptoms, it could be about 2 weeks. But if you have severe symptoms requiring you to be critically ill, it could last up to 3 to 6 weeks. So that's kind of the ballpark numbers that we're looking at. And which is why we said 14 days as the ideal time for quarantine for people who we're saying stay home. If you have these symptoms, you need to be in quarantine for at least 14 days.
Mm-hmm. Yeah. This is most likely a question for Laura. Jennifer says, while these press conferences are helpful, they are also propagating specific questions, mixed messages. Be cautious about FedEx packages, but you are anxious if you transfer those same thoughts logically to your envelopes in the mail. As a RD, people are asking me about the produce, registered dietitian. Clearly, you cannot wash with bleach. Perhaps you can, I don't know, from clinicians is better than making the person inquiring feeling anxious.
So the process of washing, I'll address that piece of it, and you can probably address the anxiety piece. But the process of actually washing is, there's multiple pieces of the process of washing that removes germs, mm-hmm. right? That breaks that chain of infection. So there's a mechanical piece of it. So when you tell kids to wash their hand by doing this process, the process of the actual friction itself plays a significant role of removing the bacteria, or viruses in this case, from the surface. So although you can't use bleach on your vegetables, just the mere process of running water through them help to remove a lot of high-tier bacteria, viruses from from fruit, so to speak.
Does it have to be hot water, or can it just be?
Doesn't have to be hot water. Doesn't have to be hot water, yeah.
All right, Dr. Saunders, do you want to take the anxiety piece of
Yeah,
that?
I mean, I think I don't see anxiety as a bad thing, right? So I think it's okay to label, well, I feel very anxious right now. And these are anxiety-provoking times. I think a great majority of us feel anxious. That's not necessarily a negative thing. Where it starts to hinder your ability to function, right? So those of us that still have to go to work, right? We are all working here. If anxiety hinders my ability to function and prevents me from doing what I need to do, if it hinders my ability to take care of my children, I think that's when it's problematic. So it's okay to be a little bit anxious. We are more self-aware now than ever before. But I think it's good to label it, right? So when the anxiety is hindering your ability to function, hindering your ability to interact with people, if you're not just practicing social distancing, but you're totally quarantining yourself without any symptoms, that's concerning. So that's where we want to rely on facts and information to help quell the anxiety. But I think we're all a little bit anxious right now. That's not necessarily a negative, but don't let it hinder your ability to function.
Yeah, and I think being anxious to a certain degree is good because it's allowing us to be more self-aware and causing us to think like that. But when you do get to that point where it is affecting your daily life, that's when it becomes an issue. We have a question from Caitlin. She asks, what about flying in 4 weeks with kids? Thanks, Caitlin, for that.
I'll let you handle that.
Of course you will. Challenging question. It's hard for me to say. I don't know what's going to happen in 4 weeks. I think right now I would say if you have to fly with 4 kids, it can be challenging, keeping surfaces clean, keeping kids' hands clean. It's very hard to tell kids not to put their hands in their mouth or
touch their
touching your face.
And
and just the process of flying, going through the airport, you're now introducing them to multiple surfaces that has multiple potential of being vectors or areas of means of transmitting something to them. So I think it's challenging, but if you put the appropriate initiatives or efforts in place, you should be fine.
We have a question from Jennifer. She asks, what are Hartford Hospital's outpatient practices doing across via policy to protect patients for necessary appointments, including the most vulnerable demographic?
There's been multiple communications to our patients regarding non-essential services, so to speak. People who need to be seen by their providers, that definitely has to happen.
Of course.
And that's something that as healthcare providers, we accept that level of risk. Our job as healthcare providers is to provide that service to the community. So people that needs to be seen, we're putting every effort in place to ensure that the providers and staff are safe, and definitely patients are safe. But there's services that we've looked at and we continue to look at that are probably non-essential services, and we're putting efforts into deciding what to do to move forward with that, definitely.
Exactly.
What we're doing in that situation, because I work in transplant and I do transplant infectious disease, is that we're telling our patients that if you have a fever or a cough, call us, let us know, and then you will still need to come in, because the fever and a cough can be the list of things that can cause that in somebody who is immune compromised. It wouldn't just be COVID-19. It could be a list of other things such as a bacterial pneumonia, an unusual atypical pneumonia. Fever could be for many, many, many other reasons, and we do not want to ignore that in a patient whose immune system doesn't have the ability to fight. So those are the people you would call us. So we're prepared to take care of you when you come to our clinic. We kind of examine you and thoroughly check you out and make sure you get the appropriate care, because just again, the cause of a fever in an immune compromised patient would not just be COVID-19 alone.
Right. Good point. Jenny asks, do kids showing symptoms also need to go through drive-through testing? Good question. Thanks, Jenny.
So I think drive-through testing right now, I don't want to use the word prioritizing, but we want to capture the people who the testing within itself will change the scope of treatment or plan. So if you have mild symptoms, my advice is, and I think the general medical community is advising that you stay home, remain in a state of quarantine as much as possible, and implement those processes that keep you safe and keep your family safe. So kids are not kids. It depends a lot on your symptoms. If your symptoms are severe, we definitely want to see you get in contact with your provider, get into the healthcare system, contact someone within the Hartford healthcare system, and we'll get you seen, definitely. And the advice would be to test if it's necessary.
If it's necessary. Yep. Heather asks, I have heard the phrase, quote, flattened the curve often recently. What does this mean, and why is it so important? There's social distancing, a lot of terms that people are becoming familiar with now.
Right, we never even heard of these terms 2 weeks ago, and now they're part of every conversation.
Absolutely. So the curve, the general curve is the disease process. We could use the curve for basically anything, right? So in this process, the disease process. So as we stand right now, I'll use Hartford Healthcare because we have that data. So we have one single patient in Hartford Healthcare, right? Actually, we've had more than one patient in Hartford Healthcare right now. But up until 3 days ago, single patient in Hartford Healthcare. As it stands, this is it. It goes up. So we have no patients, then one. So 0, 1 patient. That's going to keep going up. Flattening the curve means at some point it's like this.
Yeah.
Right?
It'll
so
plateau.
over time it's plateaued. So that's really flattening the curve. And that's where this disease process, I think for anything else we need to get right, is a community response. So from a treatment perspective and from an informational perspective, we can come here and speak to the community about this. But the impact they will have to flatten this curve is beyond enormous, beyond enormous. So an easy way to say it is we want to stabilize the increase in rate of the actual disease process. We want to stabilize that. And eventually we want to reduce. So China so far has flattened their curve, and they're going
down.
On the
downswing, right?
So they've done that. So yeah.
All right, great explanation and great question. Maggie says, can we discuss avoiding urgent cares as well? Healthcare workers are possibly carriers, and those that have not closed to patient care other than telemedicine are being burdened.
So, we're doing everything we can to keep all possible access to healthcare open. If we were to shut down these avenues for people to get healthcare if they needed it emergently, because we are in the middle of the pandemic, but despite that, we are still taking care of cancer patients. We are still seeing patients who need emergent or urgent care because of heart attacks or heart disease. There are still motor vehicle accidents. There are still other many illnesses that as healthcare providers, we are still taking care of our community. We're showing up as Hartford Healthcare and being prepared. I think if we were to shut down these urgent care centers, the emergency rooms would just be overwhelmed.
Yeah.
We would not be able to provide and give them every patient the attention that they deserve, and it would be a disservice to the community.
So just to add to that. So over the last few days to weeks, I've had the opportunity to speak with a number of healthcare providers, a number of healthcare systems. And the common concern is the fact that obviously there's the need to ensure that the appropriate PPE. The common attitude is that the healthcare providers and healthcare systems, especially that I've spoken to within Connecticut, we want to be there for the community. So we want to make sure that we're there for the community. Healthcare providers, I will admit, are at the highest risk for this disease process by far. And we want to ensure that we're there for the community. I think this is a service that, not just with the information that we're putting out, from a clinical management perspective, the best clinicians within Connecticut are working on this, and they want to be helping out within the community.
We have a question from Liz. Are surgeries being canceled this week and next week if they're not emergency surgeries, so elective surgeries?
So elective surgeries have been put on hold for now. The duration starting point is 2 weeks, and then we'll reevaluate. But at this point, we have made a decision as a healthcare organization to put non-essential, non-urgent surgeries on hold.
Yeah, and that's a category that if you have a procedure that's scheduled, I'd get in contact with the appointing office, just to ensure that whatever procedure you've scheduled is on that category, because there's a category that we've used to strategize that. So.
All right. Jennifer asks, where are you finding hand sanitizers that you are suggesting? Another $1 million question. We are using soap and water, but that doesn't help when you are in a place with limited access, like a required appointment, work, etc.
So hand sanitizer, when we use the term hand sanitizer, we're meaning soap and water. Definitely, as I said, preferably you want to do soap and water. If not, then you want to go to your hand sanitizing, the pump stations or whatever that is, or Purell wipe kits. If that's not possible and you can, there's no soap and water, there's no hand sanitizer, but you could just, I guess you could say, rinse your hand with water. Right. You definitely want to do that process. So I hope you guys are getting in contact with some form of hand sanitizer. I know it's in limited quantity right now, but definitely try to sanitize your hand in some way.
Absolutely. Susan says, thanks for doing this. It's our pleasure, Susan. Thank you so much for watching. Pam asks, what are your thoughts on family gatherings and family crossing state lines? Thanks, Pam, for the question.
So that would not be an example of social distancing. Getting together as a family, would be increased risk of transmission of the virus, and having family visit from out of state would not be recommended at this time. So we're saying to avoid all social gatherings of any kind.
Yeah, and crossing state lines as well. I just want to end quickly with just kind of going down the panel here. Just final thoughts and really what the main message that you want to get across to viewers watching. Dr. Saunders, we'll start with you.
So this is a really important time in our families, in our communities, in our towns, in our state. And this is a time for us to work together as much as possible. It is a very anxiety-provoking time. The more we can reach out to each other, talk to each other, do things that help us reduce anxiety, but most importantly, stay connected to each other. I think that's the most important thing we can do.
So important. And Keith?
Yeah, I mean, I think we covered a lot today. I think it's a lot of information, but I would want to focus on the key things. There's some very simple advice. It's, social distancing, definitely. Proper hand hygiene, absolutely. And if you're sick, if you're ill, definitely reach out to your healthcare provider. If you have certain symptoms, stay home, but and definitely use the hotline, 860-972-8100, and reach out, and we will have the appropriate information for you.
Thank you, Dr. Chima.
We had a lot of great questions. I just want to end on this note that, making change happen is an idea sometimes too big for people to grasp. And people think that they have to go out there and do something really big. I just want to end in this note and tell people that, it's every little action at this point that will count. It will add up exponentially and will really save lives. And this is what we need to think about. It will save lives of people that you may not meet, and it will also keep your healthcare workers safe. So if you know any healthcare workers who are at the front line, reach out to them, text them. I've had a lot of friends and people I work with kind of send me a text saying hi, just thinking of you, checking in on you, and and it has really meant a lot to me. So thank you for everybody who's done that.
Well, and thank you to all of you. Dr. Laura Saunders, child psychologist at the Institute of Living, Keith Grant, Director of Infection Prevention here at Hartford Healthcare, and of course, Dr. Fika Chima, infectious disease specialist here at Hartford Hospital. Thank you all for spending time with us. I know you are all incredibly busy, but I think it's such an important community service to be able to provide this type of forum and answer questions directly and engage with our viewers. So we cannot thank you enough, and we can't thank you for watching and asking all of your tremendous questions. We thank you for joining us. We are here for you. These are challenging times, but we are here for you, and we'll all get through this together. If you'd like more information, you can call our hotline at 860-972-8100 or text COVID-19, all one word, to 31996 for text updates. You can also reach out to us at hartfordhealthcare.org/coronavirus. Hartford Healthcare's Tina Verona. Thanks once again for watching, and be well.